Sit with Arcane and Persephone with me while I talk about a lesser known side effect of my Ehlers Danlos syndrome. The only reason why I know it is because the ophthalmologist I was seeing has seen quite a few patients with Ehlers Danlos and is somewhat knowledgeable on the topic compared to others that I have seen. But I am partially blind in my left eye. The reason why I'm partially blind in my left eye can be one of two things. Either natural disease processes with Ehlers-Danlos syndrome, the improper collagens affect the lens in the eye, and the pigment dies. Or it could be abnormal scar tissue from a previous injury to the eye. Mine is more than likely a buildup of that abnormal collagen on the lens of my eye, which has caused the pigment to die. So I have no peripheral vision in my left eye. If you have hypermobile joints and you are suffering from visual field deficits, it may be worth looking into a possible diagnosis of Ehlers-Danlos syndrome. It's not definitive of a diagnosis of Ehlers-Danlos syndrome, but it is definitely something that can happen to Ehlers-Danlos patients. A number of other things that I suffer from are like things like chronic constipation and brittle nails and nausea, upset stomach, motion sickness. I bruise easily. My veins are quite fragile, so when they're putting IVs in, they blow the veins quite frequently. And there's a lot of other things that kind of just happen with Ehlers-Danlos, but for the most part, a lot of the things that people suffer with Ehlers-Danlos syndrome, they don't really know is a comorbidity of their Ehlers-Danlos syndrome, or they don't know that they have Ehlers-Danlos syndrome and they have this litany of problems and they don't know where it comes from. Mine is skin problems, brittle nails, digestive tract issues, the blindness in my eye, fragile veins, bruising easily, the hypermobility in my joints, and it causes pain in my spine, has some alignment issues, and there's quite a few things that can go wrong, including autonomic nervous system dysfunctions like POTS and mast cell activation and sensitivities to heat and cold.